Hi, everyone. Welcome back to the Mass Retirees Weekly Update. Today's Friday, February 2nd. I'm Sean Duhamel. Thank you so much for joining with us and tuning in this week. Now, as you can see, I am not alone this week. We have a very special guest joining us who's also a dear friend of Frank Valeri's and mine on a personal level, as well as to our association and to all of our members. He is David Morales, the General Manager of UniCare. But like many of us here at Mass Retirees, whether it's Frank or Nancy McGovern, Tom Bonarigo, myself, what we have in common with David is that we all got our start working in the Massachusetts State House. I have known David, God, for probably 20 or more years. David grew up in the city of Lynn. He has known Frank Valeri since a very young age. And it has been wonderful over the past, say, 4 years or so since David has been at the helm of UniCare for us to be able to extend that working relationship now into this space, serving more than 200,000 Massachusetts public retirees, active employees, and their families are insured under the UniCare umbrella. David joins us today to share some very important, very exciting news about the future of UniCare, which we wanted you to all hear it straight from the source. So with that, David, take it away.
Well, good morning, Sean. Thank you for having me on today. It is truly a blessing and an honor to be with you today and with your members. I want to let the team know about some really exciting news. UniCare is becoming Wellpoint. In other words, UniCare's name will soon become Wellpoint. And we're doing that for several reasons, which I'm really excited to talk about.
So, David, I think first and foremost, the first question that's going to come to our members' minds is, why is this taking place? And most importantly, does this change anything in terms of their health care? Is there anything that they need to do? And I think I know the answer to that, which is nothing. They don't need to do anything, but let's hear it straight from you.
Yeah, absolutely. So first and foremost, members don't need to do a thing. Benefits coverage will not change, of course, unless the GIC makes changes, but nothing changes on our end. What is changing is Wellpoint. I'm excited to say a few things, Sean. Number one, as you know, I've talked a lot about whole health since I came to this organization 4 years ago. Yes, it's been 4 years. And so as a former provider, executive on the provider side, I am now excited to be on the health plan side. And it's clear to me, healthcare must transition away from sick care. And so one of the reasons why we're renaming UniCare, changing it to Wellpoint, is because we want to continue to focus on whole health. It's crucial that we as people enable each other, empower each other to think about our health first. That doesn't mean go to the hospital. That doesn't mean go to see the doctor. That means, what are we eating? That means, are we staying active? That means, is environment, our surroundings healthy for us? And as a health plan, as a health benefits organization, we are continuing to shift our services to enable and empower members on their health journey to their whole health so they can live healthy and wellness lifestyles. So that's number one. And then number two, the name reflects our values. We're here to service and empower our members to live an incredible life and health journey. And so as somebody who cares deeply about state employees, a former state employee, we're going to continue to go hard and invest hard in enabling whole health for our members. From digital tools like Sydney, the health app, if you haven't tried that, check it out. It's remarkable. Everything you need generally for your health services is in the palm of your hand. We're going to continue to invest and partner with organizations like IBIS Health, thanks to you. That's a remarkable organization doing proactive health management. We're going to continue to broaden our mental health and substance use network across the state and New England. That's part of living a healthier lifestyle that's outside of a hospital, right? We've got to proactively think about our health first. So Wellpoint reflects that mission and focus really wonderfully.
Excellent. That's all things to look forward to, and we're looking forward to continuing our good work together. Now, in terms of the logistics for our members, when does the name change officially take effect? If someone has a UniCare card now, is that good for the remainder of the fiscal year? I would assume they're going to receive a new Wellpoint card at some point. Can you walk us through that process?
Yeah, absolutely. It's a great question. So again, nothing changes for members today. The actual change takes tangibly effect on July 1st. So let's talk about from here to there. From starting this week or starting today, you're going to start hearing a lot more about Wellpoint. So from a marketing and branding perspective, you're going to see our name more. We're going to officially call ourselves Wellpoint, but that doesn't mean anything for the members. The member services member will not be impacted. Just the branding, marketing from now until July 1st. Members will start receiving information during the open enrollment process. I believe that's April 3rd. They're going to start to see their materials branded Wellpoint. So that's when members will tangibly start to receive information as Wellpoint. And then, of course, July 1st, members will receive ID cards, letters, everything that we do going forward after July 1st. Tangibly, documents, materials, IDs, website, that will all be Wellpoint branded.
And what in terms of the providers, do the members need to notify the provider of the name change, or is that something that Wellpoint is doing on their end?
Yeah, thanks, Sean. We're handling all that on our end. We are starting to communicate with providers across the state of New England that our name is becoming Wellpoint. So the members don't have anything to worry about. And like any other instances, right? If members have any concerns or run into issues, they can feel free to call us and we'll help them address whatever issues they're having with providers. But the members need not do a thing. We're going to handle all the homework. A part of my job, Sean, as you know, is to not give our members homework. So this is our assignment. We'll take care of the work. What members need to know, though, is that when they see Wellpoint, it's the same organization they're familiar with, the same service they've come to expect, the same support they've come to expect from us, they're going to receive as Wellpoint.
Of course, David, one of the most pressing issues with our members and complaints that we get just across the board when it comes to healthcare is cost and affordability. Can you elaborate a little bit on the steps that Wellpoint is taking now and is planning for the future to address affordability in healthcare?
Yeah, it's an important topic. I say publicly that healthcare costs are probably one of the most fundamental problems facing America today, and I stand on that. So several things. First and foremost, we continue to engage with our provider partners to manage the annual increase in the rise of provider prices and costs. I think the Health Policy Commission, CHIA, and state governments, and even federal government have done a really good job of documenting the fact that over 80% of healthcare costs are provider prices. So part of our job is to partner with providers to negotiate contracts and services that hopefully don't pass on an extreme amount of cost to our members. That's frankly, I hold myself accountable for that. And so that's number one. We try to negotiate the best contracts possible with providers to make sure that we both are able to offer our members, of course, robust access to healthcare services, but also in a reasonably affordable manner. So that's number one. Number two, we're partnering with our provider partners to think differently about healthcare. In Massachusetts, we tend to be a very hospital-centric state. And part of our agenda here in the past 4 years has been, how do we move away from that? How do we encourage people, our members, our organization, the culture, to think more about primary care, to think about our health first, right? It starts with us. We need to enable and empower ourselves and each other to think about, what can I do to take control of my health, to stay healthier, so that I don't have to engage with a hospital as often or a doctor as often. And so part of what we've been doing is investing in services like Sydney Health, IBIS Health, behavioral health support, social services, dietitians, so that our members can feel like their health plan, Wellpoint, is their partner in their health journey to stay healthy and active. And then number three, finally, we're continuing to talk publicly about what are steps that our members can take to do that, educate them publicly. We do a lot of things through social media, so I hope members are following us on social media, where we educate members about steps they can take to think differently about their health or health care. For example, you don't always have to go to an emergency room. Mm-hmm. You can have a conversation with our digital nurses on your app, Sydney app, or through telehealth and say, hey, look, here's what I'm thinking, here's what I'm feeling. What do you recommend I do? First step typically, as you know, historically was always to go to the ED. You don't have to do that anymore. you have a lot of robust services available through Wellpoint that you can tap into. So we're trying to educate our members as much as possible about their health journey.
So just so for members who are enrolled currently in UniCare, soon to be Wellpoint, the tools that David is talking about, we're going to make sure that we're publicizing those tools, the information of how to contact UniCare, soon to be Wellpoint again. All that information is contained on your healthcare card. So if it's something that you're looking for today, it is contained on your insurance card. But again, we're going to help publicize this, get this information to you. I know, David, we've been working together with Sensio Systems to promote the IBIS telehealth platform for roughly a year now. And I think from the early indications are that we're seeing the positive results that all of us anticipated, lower instances of visits to the emergency room. So, that'd be one great example. I don't think any of us want to spend a single moment in the emergency room if it can be avoided. Of course, if you're having an emergency, absolutely access that. But there are other tools available to help avoid those situations as they arise. Can you talk a little bit about the app? And I assume that that's on a mobile device. Is that something that can be downloaded through the Wellpoint website, or how can members go about accessing these tools?
Yeah, so they can visit our website. For the transition to Wellpoint, I encourage them to visit unicare.wellpoint.com. I'm going to say that one more time, unicare.wellpoint.com. And so they'll be able to learn more about the Wellpoint name change. In terms of our services, you can visit our website and look at all the apps. Sydney Health app is just a remarkable tool that you can use to proactively manage your health services, your health benefits, to do a live chat with our members. You don't have to call customer service anymore. You're going to get a real live person through a chat. So we've evolved our services to be interactive and proactive for our members, right? Our members are busy. Our members have families. Our members have lives. We're doing everything possible to not give our members homework and to make it easy for them. So if you want to chat with us, go ahead and send us a chat. You're going to get an immediate response. So we're changing in very deliberate ways how we engage people around their whole health.
And just a couple more points, and then we'll wrap this up. But in addition to providing a Medicare supplement plan for retirees who are Medicare eligible, Wellpoint, UniCare also offer a variety of plans, not just for the Medicare population, but for non-Medicare retirees as well as active employees. Can you just touch on those choices just quickly?
Sure. So UniCare, Wellpoint, offers 4 different products. We're going to continue to offer for active employees, non-retirees, total choice. And full disclosure, there are some retirees that didn't qualify for Medicare that are still on total choice. So that's a wonderful product that you can look into if you don't qualify for Medicare and want to look at a very comprehensive product, total choice. The second one is Plus. The Plus product is a tiered hospital product. It's our most popular product, our product with the largest number of members. So the Plus product, and then Community Choice. And Community Choice is our narrow network product. It's the lowest premium product on the GIC shelf. It's wonderful, but it is lower premium because we treat Mass General Brigham facilities as out-of-network providers. And so we're able to take down the premium substantially downward, more affordable than most of the products. And that one I encourage members to think carefully about, because if you live in Eastern Mass and are going to go to Mass General Brigham facilities often, it might not be the right product for you. But if you live in Central Mass or Western Massachusetts and don't need to frequent a Mass General Brigham facility, it might be a really solid product for you. And then the final product is the Medicare Sup, OME, for retirees. And that is a very popular product. We have almost 100,000 members in that product. It's very popular, and we're honored and proud to offer that. And that's where we partner with IBIS Health, Sensio, who's been a remarkable partner in proactively engaging members in their health journey.
Now, David, I think you touched on some really important points, which is a great segue into the fact that we're going to hold a special Tele-Town Hall meeting with David and the team from Wellpoint / UniCare coming up on March 29th, just on the eve of the GIC's open enrollment period. The GIC will be finalizing the premium contributions at their next meeting in early February. The news that we announced just recently that GIC has chosen to hold the line on increases when it comes to co-payments and deductibles was extremely important and welcome news. And congratulations, David, for the part you've played in helping to hold the line on those costs. But this will mark the 7th consecutive fiscal year with no increases in co-payments and deductibles at the state level, which of course can very quickly become local policy as well. Now, can you just touch a little bit, Wellpoint, UniCare have been a partner of ours in the GIC since 1988. Talk a little bit about the company and where you're located, where your workforce is located. I think that's an important point for us to end on.
Yeah. Well, first of all, we're from Massachusetts. This is our home. And I've said this before, we're accountable for the services we offer. Offering services to our neighbors, to our members, that's personal. And so most of us are from Massachusetts, and we take this very seriously, and we're proud. When we're driving around Lowell or Lawrence or Lynn or Springfield, Weymouth, there's a UniCare member everywhere in Massachusetts. And so we're local. We're your next door neighbor. The second thing is our offices are in Woburn, Massachusetts. So anybody ever want to come visit us, we're here and we're open for business. And then finally, and I mean that. And then finally, this is a labor of love. This is a passion for us. One of the things that we talk about as we transition to Wellpoint is your whole health is our whole point. That's our theme. Your whole health is our whole point. And the whole point of us doing this is because we're here to serve you. I said recently to a local mayor who was aware that GIC, it's a GIC community, said, "Oh, UniCare, yes, most of our employees are in UniCare, so we're sort of like we're kind of like in your debt." And I said, "No, Mayor, I'm sorry, we're in your debt. We serve you. We serve the GIC, and we're here to support whatever needs you have." And so we take that to heart. Our job here is to make sure that our members come first and that they have everything they need to live a healthy lifestyle. So if you're ever in the Woburn area, come check us out.
Well, David, I want to thank you again for taking the time today. We're excited to continue our relationship. And as I said, our work with UniCare, now Wellpoint, goes all the way back more than 30 years, 35 years, I guess, to 1988, before I was here. So with that, again, thank you. We are going to hold a Tele-Town Hall featuring David and the team from Wellpoint again on March 29th. I hope you can tune in. Even if you're not currently enrolled in a UniCare product or soon to be Wellpoint product, I'm sure you'll still learn something and have some positive takeaways from this meeting. So David, again, thank you for you and your team and all you do for our members. And we look forward to continuing to work together.
Thank you, Sean. Have a wonderful rest of your day.
All right. Take care, everybody.